Okay, so good afternoon, everyone. Thank you all, everyone, for joining this session. So today's session, we would be taking on webinar for understanding cholesterol and the heart risks. So to have this session, we have Dr. Jitendra Mishra with us, who is a senior consultant, clinical and preventive cardiologist, doctor in Medanta. So he would be helping us to give us the deep dive regarding the topic. He would explaining about how cholesterol affects the heart and what are the precautionary measures we have to take care to prevent ourselves from the heart breaks. So before I start, I would like to introduce Dr. Mishra. So first of all, sir, thank you so much for joining. And so Dr. Mishra is an experienced clinical and preventive cardiologist with an over 33 years of experience in cardiology, including his leadership role at IVY Hospital, Mohali, and Ali Hospital, Doha. He also possesses extensive expertise in managing both acute and chronic cardiac disorder, particularly focusing on preventive interventions. So I would request Dr. Mishra to please take it ahead from here. And first, thank you so much for joining, sir. You can just take it ahead from here.
A very good afternoon to all my listeners, and I hope I won't be boring you all, but I'll give you a good carry home message because a stitch in time saves nine, and prevention at this moment is the only solution which I feel uh, can prevent this gigantic problem of coronary artery disease or stroke or kidney failure because of atherosclerosis. So we would be letting our listeners go smoothly along this simplified and basic information about lipids. So just briefly about myself, I was heading Department of Cardiology and Medicine 20 years back, and I have been abroad almost more than 2 decades, including UK and Al Ahli Hospital, Qatar, and in various parts of India, including Sri Sathya Sai Institute in Higher Medical Sciences in Andhra Pradesh. So let's start now. Cholesterol screening, an independent and proven risk for atherosclerotic cardiovascular disease. Now, what is atherosclerotic cardiovascular disease? As the name suggests, atheros comes from porridge-like soft and affects the blood vessel chain or pipes which are laid down in all of the body. And that's the reason that by preventing or stopping this disease, we can protect our brain, heart, kidney, eyes, and multiple places. So where are we now going? Is it a myth or a truth? Because a lot of non-scientific people keep on posting information which always misguides the main chunk of people who think that cholesterol can be good also. Now I have nothing to do, disclose. I have no declaration to make. This is for the education of my very learned listeners. Now, to begin with, nothing that God has created is absolutely good or bad. And the same is with lipids. Lipids are nothing but they are fatty compounds that perform a variety of function in your body. So essentially, it is the structural part of cell membrane, all the cells which are there in the body, and it helps controlling what goes inside the cell and what comes out. Even our blood vessels are made up of cells finally. So when it controls what goes in and what goes out, it also includes the lipids. Also, it is helping in moving and storing energy, especially triglycerides. It also helps in absorbing vitamins and making hormones. Hormones are so important. So lipids in reasonable level have its own physiological function. But what is harmful is having it in too much amount. Then fatty or waxy substances, these lipids which are made up of, they are unable to dissolve in water. So therefore they combine with proteins and then they are known as lipoproteins that can move about freely in the body along the blood. Now, before we jump into the topic, it's a very common discussion. What is HDL, high density lipoprotein, and what is LDL, low density lipoprotein? As the name suggests, high density means less volume and more weight. Now, this high density lipoprotein is very helpful because it gets rid of the bad cholesterol in the body. It also fights inflammation, blood clotting, and oxidation, which is one of the underlying basic mechanism behind stroke and myocardial infarction or heart attack. Now, LDL or the bad cholesterol, it can stick to the blood vessel wall and make it harder and degenerate. Now, before we also think about screening for cholesterol in our body, there has to be a rationale. The rationale is that the lipid values in abnormal range is highly prevalent in our population, especially Asian population. We are red alert, we are red flags. And it has been well documented that there is a strong relationship between this bad, we call it low density lipoprotein cholesterol, and coronary heart disease risk. Treatment has been found to be very effective. It decreases the risk of cardiovascular disease and events. The earlier we come to know, it starts with being acknowledged or having knowledge about the problem. Early knowledge of the lipid disorder creates the best opportunity for early intervention. The reason is it almost takes many years to bring the damage to the blood vessel and ultimately giving rise to stroke, heart attack, etc. So earlier we know, we have preventive measure in place and we prevent it or delay all these events. Now, the principle of screening is so simple. For a tool to be sensitive enough, easy and reproducible, then only we can use it as a screening tool. The problem which we are going to screen has to be a substantial population problem. And in this case, lipid abnormalities, we know that it affects somewhere more than, in some countries, more than 30% of the population, and somewhere it can go above 50%. So it makes a case that we should screen it. It has to be gone through, or lipid profile has to be checked, and it's a shared decision between physician and the patient. And there are multiple treatment options which are very, very effective. Another reason of screening something is when it is very, very strongly related to disease condition. So we know in this case that there is increased LDL and relation of atherosclerotic cardiovascular disease. Now, just to give you a take-home message, what are the reliable things which we can test? And also whether it should be tested in fasting condition or non-fasting condition. Now, even the fasting condition has not been made mandatory. And what is important is, if you cannot do anything, just go for at least total cholesterol. And preferable it is to go for APO capital B. And at least in Asian population, I'll explain that later, LP small a. Now, LP small a is a new subfraction of bad cholesterol, LDL cholesterol, which is genetically present in a good chunk of Asian population, and it is independently giving rise to heart attack, stroke, etc. So, just by going through a total cholesterol, if you cannot go for full, lipid profile, which will include HDL, LDL, triglyceride, IDL, VLDL. So I made it very simple that we can just go for ApoB, total cholesterol, and once in lifetime, LP small a. Now, this is a glimpse of what we get in the screening. We get the good cholesterol, which is high density lipoprotein, and desirable limits are above 60. But even if it is above 40, which is the cutoff range, it's good enough. It increases by all healthy endeavors which we take, this will protect your heart, kidney, brain, eyes, everything, and it improves and increases by doing regular exercise, taking the right diet, avoiding harmful addictions, maintaining ideal body weight, removing stress, etc. The other one is low density lipoprotein cholesterol, which has the strongest link we have towards atherosclerotic cardiovascular and brain diseases. Now, ideally, now if you are a patient already having atherosclerotic disease, the cutoff is below 50 preferable, or at least below 70. But in normal population who don't have it, we give it little fairly wider range, 60 to 130 milligram per deciliter. Now, the third thing which you always see in your lipid profile is triglycerides. They have to be below 150, ideally. And what are these? These basically triglycerides represent our metabolic status. It is more closely related to obesity, diabetes, sedentary lifestyle, excessive alcohol ingestion. It is not as strongly related to heart disease, but nevertheless, it has implications. It can contribute and make up a team with LDL because it is usually associated with all other risk factors like lack of doing exercise or being a diabetic, etc. So that is also included. And lastly, when all of these are combined, we get total cholesterol, which should be ideally less than 200. Now, this gives you little screening when you check just total cholesterol, because total cholesterol is a mixture of all these subfractions, so it can be sometimes misleading. Now, what is the key goal of screening? We have conditions like, for instance, we have familial hypercholesterolemia, where it's a genetic predisposition in the population because of which we have high cholesterol values. We have other genetic disorders associated with atherogenic cholesterol, atherogenic or atherosclerosis causing cholesterol. And the question is, are only the reasons of doing a lipid profile A and B, or all of these? There are certain acquired conditions. For example, if you have thyroid issue, if you have metabolic issue like you are diabetic or you are obese, then also you have to be very, very clear that you should undergo from an early stage a lipid profile, which is so simple to do. So the answer in this case is all of them, not one of them. The World Heart Organization laid down certain principles of cholesterol screening. The reason being, as I have mentioned, I'm just reiterating, leading cause of morbidity and mortality worldwide. In US, in fact, you have 6 followed by 5 zeros die of heart disease each year. Of those with the heart disease, coronary artery disease is the most common killing, almost like 370,000 people annually. Then abnormalities in the lipoprotein metabolism, which we are discussing, which is today's topic of LDL, HDL, triglycerides and all. 50% and more of the population, the disease comes because of abnormalities in lipoprotein metabolism itself. Now, cholesterol screening has lot of potential to identify primary and secondary conditions. Now, primary conditions are wherein you get genetically mutated generation of people in the population, which can be caught very early by doing the test. And there are certain acquired conditions which develop later on. That's the reason that by adopting a very healthy diet lifestyle, we can postpone conditions like obesity, medication induced, for example, somebody on steroids and all. They can also have side effects in the form of having abnormal lipids or rheumatoid arthritis, all those inflammatory conditions like collagen vascular diseases, HIV, all those people have abnormal and bad cholesterol values, which can be treated and the benefits reaped. It is therefore critical to identify the primary goal of cholesterol screening. Many believe that it's just catching the familial hypercholesterolemia, which is genetic in origin and which also composes a huge population percentage. For instance, we have 100 times greater chance if we have a family history and genetic abnormality, whether both the genes or single genes are involved. And in children with untreated familial hypercholesterolemia, have a dramatic increase in premature coronary artery disease. After 20 or between 20 to 30 years, they can have heart attack, they can have heart disease because of this problem. Now, almost like 1 is to 250 in the population have got familial hypercholesterolemia. India is awakening now, growing very fast in economy and all. Now is the time that we should unroll the preventive part of aspect of cardiology, because this is going to be the capital of heart disease in the world unless steps are taken to prevent it. So you can imagine that almost like 1 is to 250 ratio will have FH abnormality, familial hypercholesterolemia in the population. So imagine 1.4 billion population, 1 is to 250, how many patients you will get who will be benefiting from proper treatment and screening. Now, usually, you know that the diseases which come out, which indicate that you have abnormal lipids in the body, it is like blood pressure, which is known as silent killer. It doesn't show up. Only a early stage screening will catch, but there are certain signs. Signs are what we can see. Like in this gentleman, you see some erytheromatous, that cholesterol deposits around the eye. We call it xanthelasma. You can see in certain people if the clinician is very careful in observation. Then in children who have familial episodes of high bad cholesterol level, they can have even in the legs, we call it xanthoma. If you see clearly the leg at the Achilles tendon, there is deposit of lipid there causing a lump. In around the eyes, you see a white ring of cholesterol. We call it corneal arcus, which is very specific in less than 45 years especially, and indirectly it suggests that you should undergo a lipid screening. Now, current diagnosis and rollout of screening program in India is highly inadequate. You can see even less than 1% of the population, although this data is little older, less than 1% of population really has awakened, is knowledge enough to undergo a simple blood test and know his lipid profile. And despite this fact that the treatment is so effective in prevention, this kind of simple testing is delayed. Some of them argue that the principle of screening should only be applied to an age group above 40 years. We all agree that above 40, universally the screening program should be there. But many large studies have shown that even younger adults who are aged 18 to 35 and above should be screened by a lipid profile. In parents who have both the parent having a heart attack at an early age, even above 1 year of age, the child should have screening for cholesterol abnormalities. The prawns are the benefits. The good points is diagnosing is very simple. Although diagnosing is just the beginning, There are two modalities mainly how we treat this. It's very simple. One is non-pharmacological means of treatment of abnormal cholesterol or lipids. The other is through medications. And lastly, we have a very innovative new research showing that injectables once in 6 months has also been proved to be very effective. Now, in non-pharmacological means, we all know that we should avoid stress, we should have regular exercise, we should have a healthy diet, which is less in trans fat, processed, food stuffs, junk food. Everybody is knowledgeable enough. We should emphasize on lean meat if we are non-vegetarian. We should emphasize on nuts and all. And plus, we should also be active enough. We should do at least 5 to 6 days a week of good exercise, burning 150 kilocalories per day. The benefit of screening all the individual above 40 years is highly recommended and scientific. Even in young children, when we diagnose, we have very good scientifically backed medications which are available. For example, children above 6 years, they can be put on rosuvastatin, one of the statins, and children above 8 years and older, pravastatin. Children above 10 years of age and older, we can put them all on all the statins. Then there is another group, we call it ezetimibe. We have bile acid sequestrants, which is known as colicivilam, and sometimes even when the medications are ineffective, same like we dialyze the blood for kidney failure patient, we remove through machine the bad cholesterol from the blood. We call it apheresis. It is very straightforward treatment in adults. We have statins as the cornerstone. As we all know, it blocks, it's a group of medicine. It blocks the breakdown of lipoprotein receptor in the liver, and thereby it upregulates the receptors which clear the bad cholesterol from the body, in a nutshell. Ezetimibe is another group of medicine which impairs the absorption of cholesterol from the gastrointestinal tract itself. So nowadays we are combining very commonly statins with ezetimibe, and both of them are given in a reduced dose to prevent the side effects. The third one of the group is bompidoic acid, which is also very helpful in fatty liver besides reducing the bad cholesterol. The third one, which has come recently, is PCSK9 inhibitors, and one of the new one is RNA strand, which is coming as inclisiran. This is also very effective, especially in people who cannot tolerate statins. And it's just given after the loading dose once every 6 months. So what was said by National Heart and Blood Lung Institute expert panel that all the children should undergo lipid screening. But what was heard, and which I also feel would be practical in developing countries like India, is at least inclusive of above 40 years, everybody besides children who are obese should have, and who have strong parental history should have, even much earlier age screening for lipids. Now, see, this is like a silent killer inside. We have usually no symptoms. So we should suspect it in order to diagnose it, especially when the results of treatment are so good. Identifying children is so critical in reducing our most what you call productive population. Our Indian demography shows that out of all the nations present on the globe, India has the greatest number of youth population who will be benefiting immensely. One more test which I would like to include here, which is so simple and non-invasive test, which can also give us idea about the health of our blood vessel. This is known as non-invasive imaging of carotid arteries or the arteries in the neck. We call it carotid intima media thickness. It takes just 1 minute to check it, but it tells you indirectly, adds to whatever we have found. Now, picture speaks a lot. You see on the left side, we are used to having Zomato, etc., which just brings the food to our table. God knows in which oil it is cooked, and it is so harmful. On the other side, if you even have constraint of cooking, it's simply chopped vegetable, lot of salad, tomatoes, and soaked, germinated sprouts, which can make a very healthy food for us. So mostly silent. The decision which after this lecture we would have taken, I believe, is I can expect some kind of promise from you all. Your health in your hands, from the heart it is coming out. Please check your lipids at least and make your life healthy, wealthy, and long lasting. So these are some of the slides wherein it says that at what age it should start screening. Ladies usually are protected for 10 years further than men because of the estrogen, which is protecting their blood vessels to develop heart disease slightly later. But I have been seeing, because I was in this field and almost 30 years, 33 years I'm practicing, that this has little bit changed overall in India after pandemic especially, and plus the urbanization and highly sedentary lifestyle. This problem is going to be the next bomb for health issues in India. So our US Preventive Task Force says that all of us should have at least total cholesterol screening done, if not all of them. ApoB is representative of all the bad cholesterol fractions like your LDL, IDL, VLDL and all. So even if you just check your ApoB, that will tell us your risk. And at least once in lifetime, LP small a. Even measuring total cholesterol alone is acceptable. Now, optimum interval, how much frequently you should do it. If you are on treatment, you are already having a heart issue, then every time we are changing the statin dose, after 3 months, you should check your lipids to see how much change it has brought. Otherwise, if it's just a screening and preventive, primary prevention, we call it, where the disease has not come, every 5 years from 40 years onwards, you should check it. There's no age wherein the screening should be stopped. Okay. So we have gone through this, and I don't want to really get bored of a lot of theoretical aspects. We know that despite giving so much information, lectures and all, still we miss almost 30 to 60% of children who could have benefited by starting anti-cholesterol medicine, and later on losing our productive population of this great nation by almost like 30 to 60%. Any person who already has the target organ affected, whether brain or kidney or the heart, you know what kind of productivity will be impacted on his life. Now, why all this topic today, it became so important? It has no symptoms, okay? It is controllable, it is reversible. It starts as a very, very fine, small lesion initially, if you see in this graph, where the blood is flowing smoothly, and then you see an orange circle in the next picture where the lipid has started accumulating. In the next one, it has progressed, and finally you see the real lumen in the blood vessel has become so small that cholesterol is the major part of the blood vessel, and this leads to ischemic heart disease or coronary artery disease, which is the main reason of heart attack and heart failure. The other is brain disease, which can mostly lead to stroke. The third is also very, very important. which I didn't discuss before, is peripheral vascular disease, especially found in smokers and diabetics, which have bad cholesterol, which can lead to erectile dysfunction and painful symptoms in the legs whenever they are exercising or exerting, known as claudication pain. Now, all these bodies which are there, you can go through. They all recommend that it is the best policy to start early, to start the prevention and benefiting from it. Statin is still the most cornerstone of the treatment, easily available everywhere in the world. And if diagnosed in a proper way through screening, we would additionally treat young adults and adolescents, which are almost like 400,000 missed cases. What are the barriers? The barriers are from our side also, we should take the blame, that the physicians lacking knowledge never advocate this simple screening thing and treatment. And plus the from listener side, if they have little bit lethargy or they procrastinate or they feel that okay, once the problem will come, we will handle it. External barriers, we call it. These are patient related. Lack of acceptance, or even if it is expensive test, although this test is not very expensive, and lack of time and lack of consultation with the physicians. Principle of screening, we know that it's a shared decision. Medicines are established. There are primary and secondary causes. The outcomes could be bad, and it constitutes a huge chunk to the population, which can be made healthy by simple testing and treatment. There are final thoughts which I would like to give you through so that you can take it home. There is no universally accepted screening program. I mean, it has not been made mandatory like Netherlands. You would be surprised, they have 80% of the population which has already been screened. So at least I can say that let's start screening ourselves. If we have a family history earlier than 40 years, or otherwise at least at 40 years, we should start screening, and thereafter every 5 years. Also, we should not forget that I talked about lipids today in my lecture, but lipid is just one link in the chain of causation of atherosclerotic cardiovascular disease. We have to adopt a totally healthy lifestyle in a very long marathon race, not a sprint. For instance, we should have a routine, we should have adequate sleep time, 7 to 8 hours a day, we should do exercise regularly, we should eat healthy, we should not overdrink, and we should stop smoking, we should control our weight, we should also control our numbers. There are certain modifiable risks in which it's like your sugar, your cholesterol, your smoking, your drinking habits, your exercise, your weight, etc. There are certain non-modifiable risk factors which you cannot do anything about, but at least you can screen. They are the genes, the age you can't change, and of course the gender also. Males develop the disease 10 years earlier. Statins constitutes the cornerstone of the treatment. See, we all know that knowledge itself makes you scratch your mind and you throw in the dustbin procrastination, and there the solution comes and you move in the right direction. The time course of human atherogenesis, we all know, it can lead to, as I discussed before, ischemic heart disease, cerebrovascular disease, and peripheral vascular disease, erectile dysfunction. Lot of other territories can be involved. Okay, lesson is we have to prevent it and we have to have a long, healthy life. Early detection is the key. And this is my last slide. I would like to just close. It just this picture is very descriptive. I don't say just stick to this. You need lean meat if somebody is a non-vegetarian, and plus a good source of protein and complex carbohydrates too. But yes, the base of the pyramid, where you should have two-thirds of your food, is represented here. I would welcome my intelligent guests who are listening to me with patience on this boring topic to come out with any questions if they have, and I would be very glad to answer them. Hi, Sahid, am I audible?
Yes, sir, very much.
Yeah.
Okay, so I hope what I would be doing, I would be putting the questions one by one in the chat box, sir. You can just answer the question one by one. Okay.
Sure.
Sir, I'm also there on the call. I'll read the questions to you once I see the question coming up in the chat box.
So thankful to you, Mansuri and Shahid.
So, sir, we have our first question, which says, will you be able to share what test we should go for?
Yes, it's a very, very important and useful question. Ideally, nowadays, I would also like to give it as a very, very strong message, because we usually start all the preventive aspects, especially in India, unlike in the West, at middle age or around 40s. So, usually, what I suggest is you should have a baseline test done by having a biochemistry which will depict your liver, kidney, the hemogram, and plus the lipid profile. Why I said that is, if suppose we venture on preventive medications, then all these medicines are usually metabolized through the liver or the kidney. And lastly, there is an emphasis that we should also have one baseline, the structure of the heart through simple echocardiogram, the function of the heart through treadmill test. And if somebody has got multiple risk factors, I strongly advocate for him to undergo CT coronary angiogram. Imaging has got a lot of emphasis now, because if it is a non-obstructive disease, all the other tests which I have mentioned will miss the underlying disease, which can contribute to heart attack, stroke, etc.
So, sir, we have another question. Does low blood pressure raises the chances of a heart attack?
See, there is a very straight answer to this important question. If it's a constitutionally low blood pressure, it cannot be, in fact, it can represent sometimes a longer lifespan, increased longevity, if it is constitutional. But if it is secondary to some other cause, low blood pressure, ultra low blood pressure, then we have regions in the heart and the brain which we call a border zone, penumbra area, where because of low blood flow itself, you can get ischemia or lack of blood flow symptoms in the brain or the heart. So per se, I have seen in my span of practice where, especially ladies, they used to have blood pressure somewhere around 100 higher side and 60 on the lower side without any symptoms, and they were more healthier as compared to people who had higher blood pressure.
Thank you for answering that question, sir. Is it possible to reverse, stop, or slow down atherosclerosis? If established, are there non-invasive ways to determine if atherosclerosis has slowed down, stopped, or reversed? Question asked
Yes,
by Manish.
very, very interesting and very good question. I would say that with it has been substantiated scientifically through very advanced techniques like PET scan or through occlusion tomography, which is a special technique of introducing the blood vessels in the heart, wherein it has been found that with drastic control of all the risk factors, the disease was even reversed. But having said that, practically, if we start treating, if we are able to halt the disease where it is, it does the trick. So, exhausting your lifestyle only in exercise and diet control and medicine and losing weight, you get fixated into health. In research setting, it's fine, but practically, I want to say is eat in moderation, eat right, and do the right thing, and then medicines will help at least stopping, halting, or reducing the speed of the disease. That itself is good.
Thank you for answering that question, sir. So we have another question from Mr. Sudhir. He says he has high cholesterol levels from the last 3 to 4 months. Could you suggest some precautions he need to take?
Yes, of course, I can suggest to Sudhir. He should first of all awaken up and make his willpower little strong so that even if he misses his dinner, that doesn't matter, but he has to hit the gym. He should start doing regular aerobic exercises. Number two, he has to give attention to what he eats. Now, he should have little amount of lean meat, allowed amount of protein, complex carbohydrates, and lots of dark green leafy vegetable as I have shown in the picture. He should have cooking done in good fat oil, for instance, canola, olive oil, or soya oil, groundnut oil. They are fine, but the best one is olive oil. In a way, the nutshell is if he adopts to Mediterranean diet, they have been found to be very healthy, or Japanese kind of diet. Just taking a hint, we can't change our culture, but he has to. And then, if all these efforts of exercise, ideal body weight, and dietary changes, he should recheck his lipid after 3 months. If it is high and he has a family history, then he should start statins. He can also have, depending on his age, a CT coronary angiogram screening test done.
Thank you for those simple and doable suggestions, sir. We have another question from Sankalp, who asks, how is high sensitivity C reactive protein report related to a cardiovascular risk? Is it one of the prime factors to measure heart health if one has no other chronic inflammation?
Definitely, this is a universally acceptable inflammatory marker in the body. And now we have redefined coronary artery disease as chronic inflammatory disease of the heart blood vessels. So, as a marker, this HSCRP suggests inflammation. If there is no other risk factor at all, then this can be brought down by essentially adopting a healthy lifestyle, which I mentioned before. And usually, this is not an isolated finding. If you check the LP small a, homocysteine, and then you also do a screening for carotid artery, the blood vessels in the neck, especially carotid intima media thickness. And if you are around 35-40, having family history, having done a CT coronary angiogram, that will help us. Why I suggest these screening tests is I will be knowing after these tests how aggressive to go with you. Usually, this never comes up isolated. You will see other inflammatory conditions in the body as well. Maybe it is related to endocrine system, Hypothyroidism, diabetes, obesity, all these conditions bring up HSCRP. And same like we give marks to high blood pressure or obesity or renal dysfunction, we also give a separate point to HSCRP, which is a marker of, or it increases the risk of having future heart issues and brain issues.
Thank you for answering that for us, sir. Moving on to the next question. How to keep your heart healthy if one smokes occasionally, which aids a risk of heart attack?
See, nowadays we are living in an environment which itself is like smoking, especially talking about industrialized cities in India. You know, there is pollution. Now, pollution itself has contributed to development of heart issues, especially atherosclerotic heart and brain diseases. So, in addition to, even if we are smoking passively, I'm not talking about active. Passive means you are not smoking, but you are near to a person who is smoking. So, you are passively inhaling the smoke. That has also been proved to be a risk factor. Lastly, and not the least, if suppose somebody occasionally smokes, the nicotine in the cigarette, which goes in the blood and gives you the kick, has been known to cause spasm in the arteries of the blood vessels. So I cannot say that, it is absolutely safe. It is better occasional than a habitual, continuous, or chain smoker. But I would say that it is better to stop smoking.
Thank you for answering that question. So we have the next question, sir. Is there any relationship between high cholesterol and sugar imbalance?
Yes, we have, and especially I mentioned to you, one of the subfractions in the lipid family are triglycerides. Now, this triglycerides, they are energy stores. Usually, this is one of the bad cholesterol, not as strongly linked, but very, very closely linked to diabetes. So, these two combined, and one more thing which I would like to add here is if suppose somebody is a diabetic with a high triglyceride, but even normal low density lipoprotein. Now, there is something known as the particles in low density lipoprotein, that is dense lipoprotein particles. So the numbers are fine, but the behavior of those particles in a diabetic or in an obese person are malignant. They are looking fine, but they are causing slow destruction inside. So we have to pay attention to all the factors together. How is a person clinically looking? How is his blood pressure? How is his weight? How is his nutritional status? What kind of food he eats? What is the family history? I mean, the total body has to be seen and clinical profile and then decided what to do about it.
Thank you for answering that for us, sir. Manish asks, what are some non-medicine ways to slow the progression of plaque accumulation?
Non-invasive, as I had mentioned, there are two ways. Pharmacological means through medicine. Non-pharmacological means through lifestyle. There are good dividends we can even rear from having a healthy lifestyle. Even the cholesterol level, blood pressure level, inflammation level will reduce. Stop doing what is harmful. In that, it's your behavior. If you're smoking, stop it. If you are not doing exercise, start doing exercise. If you are overweight, reduce it. If you take more than two small drinks, you reduce it to less than two small drinks. I don't advocate, but if you have to drink, red wine is known to be a little bit having benefits in increasing good cholesterol. But you should not use it as a medicine. If suppose your liver has an issue, your stomach has an issue, then you should never drink at all. Plus, having good amount of healthy food in moderation. Fill your stomach with those foodstuffs which I have shown in the last slide and have just the allowed proportion amount of lean meat, fish, egg white and all. You shouldn't be having more than 2 yellows of the egg, and having lots of fruits, vegetable, nuts and legumes. Those itself will help keeping you healthy with an exercise, with a stress-free lifestyle, with adequate sleep. Your numbers will be improving.
Thank you for answering that question, sir. Hemant says he keeps donating blood every 6 months. Does that help?
Yes, it will not necessarily help in reducing the heart attack or stroke and all, but donating blood is a very, very safe and healthy practice. Not only it gives you a sense of returning back to the society of what we have got from the society, but the body is not at all deficient in any way, provided you meet certain conditions. You shouldn't be infected by any of the transmissible diseases. You should be not very old. You shouldn't be very young. And then you should have adequate hemoglobin. Within no days, that will be restored. But as such, there has been no treatment substantiating that donating blood on a regular basis will protect you from heart attack or stroke.
Thank you for answering that question, sir. Varsha asks, what is the impact of consuming eggs on good and bad cholesterol?
See, if we eat egg, it has two components. We have the yolk and we have the albumin. Now, I tell my patients who are taking supplemental whey protein or any other protein to stop it. Albumin is a reference protein and it is very safe, and we have been having eggs since many, many centuries. So what I suggest is, to meet the requirement of your protein in your diet, you should have egg albumin, even 3 to 4 you can have a day, but yellow, because it has got a bad cholesterol composition in that, you should avoid having more than 2 yolks in a week. So that is what is recommended. And people who are at a very heightened risk, they should avoid egg yolk.
Thank you for answering that for us, sir. Tushar wants to take your opinion on taking herbal preparations as preventive measures to reduce the risk of cholesterol and lipid on heart.
First of all, I would tell Tushar that make sure that they are coming from the right source. Certain Chinese herbs have been proven to be very, very dangerous for the liver, especially if it is, adulterated with aflatoxins and all. It can cause severe liver injury and all. So, having said that, Japanese use a lot of green tea and even ice creams, and they eat a lot of marine food. They are one of the healthiest populations on the planet. They consume a lot of salmon and all, which gives them good cholesterol. Now, all these herbal things, especially the quality, I'm not very sure of. There is a lot of debate. For instance, people said, let's start consuming a lot of garlic and that itself will be curative. Now, it was that big trial showed that for 1 month, it helped controlling blood pressure and even cholesterol. And after that, there was a rebound. Of course, it can interact with other medicines which you are taking for your heart, like aspirin, etc., and cause bleeding, injury, etc. So, taking alternative medicine, I usually don't recommend it, because the huge trials to substantiate its use, except for certain people who own the business, is not a very established fact.
Thank you for answering that question, sir. So we have another question which even I am keen to know the answer. So the question says, young population having heart attacks around COVID vaccination, is it a myth or a fact?
Very, very big, and multiple large scientific studies have proven that COVID itself, the COVID infection, led to a condition in the blood which made it quickly clot. And younger population also had strokes or thrombosis of the blood vessel in the abdomen or the heart causing heart attack. But as such, the vaccines, they have been given a clear chit as to be causing or being inculcated in having a heart disease.
Thank you for answering that question, sir. Next, moving on to the next question. Are there any natural ways to lower down LPA if LPA is high and LDL is it a confirmation of below 70? Is there still a long-term risk of atherosclerosis?
It has been a very a strong opinion which has come up in cardiovascular scientific world about LP small a. It is one of the subfractions in especially Asian population and all over the world, wherein a level below 30 was considered to be safe. From 30 to 50, it is intermediate. And above 50, people say, especially if they have already got a heart disease, they should be taken care of and brought to normal values. Now, there are certain new medicines which can help reducing it. And if statins have failed, we have PCSK9 inhibitors and injectable RNA injections, which is, for example, coming in the name of inclisiran. So they help reducing LPA. But if suppose mostly LPA as of now practically is seen to be elevated, and it becomes important in patients who already have a disease, and we see that after putting stent or doing a bypass surgery, the disease recurs very fast. In that condition, we tend to reduce the LDL below 50 and even trying to give additional newer form of PCSK9 inhibitors and injectables.
Thank you for answering that question, sir. I don't see any more questions. Shahid, passing on the stage to you.
Thank you so much, Dr. Jitendra, for addressing all the questions. So I guess we have answered all the questions. As of now, we don't have much questions out here. So we'll just wait for a minute. See like if we have any more questions. If not, then we'll just wind up the session. Okay.
Thank you so much for being listening to this interesting topic, and thanks Shahid and thanks Mansi.
Thank you so much, doctor, for joining. And really, it's a good and very informative session you have taken. It really helped us to clear our doubt, and it is one of the very burning topic in today's world. We all are facing not only the elder people, but it is affecting a young age people also. So obviously, it's very important for all of us. Thank you so much for giving me a highlight on this, sir.
My pleasure, Shahid. My pleasure.
Okay, so sir, we don't have any further questions. So thank you so much for joining, and thank you so much, Mansi, also for organizing this and helping us to to get one of the best doctor to take us through this topic. Thank you so much, team, for joining.
Have a nice day, Shahid. Bye. Take
You too, sir.
care.
Bye.
Good evening. Bye.